Hmm.
Good evening, everyone. Thank you for joining us today. So, we often blame our mattresses, our posture, or our age. We try yoga, the gym, and walking, only to find that the pain sticks around or worse, gets more intense. The truth? If your joints are misaligned, even the healthiest exercise can be doing more harm than good. So, there is a way out, whether you are dealing with persistent issues, joint health, or life stages. Today, we have with us Dr. Harshneet Kaur. uh, she has got around 20 years of clinical experience. She is former consultant at Dr. D.Y. Patil Hospital, Mumbai, and senior consultant at Cloud9 Hospital, Chandigarh. Your journey to a pain-free life starts with understanding the why behind the ouch. And we have Dr. Harshneet who will let us know more about pain and how to deal with it. Over to you, Dr. Harshneet.
Good evening, members. So, thank you so much, Varundip, for giving me such a wonderful introduction. बट मैं एक और सिंपल भाषा में अपने बारे में अगर मैं बोलूं तो आई हेल्प पीपल गेटिंग पेन फ्री। लाइक अगर हम आज की तारीख में देखें तो हर घर में बैक पेन, नेक पेन, नी पेन का केस है। कहीं ना कोई माइग्रेन से जूझ रहा है, कोई और तरीके के आर्थराइटिस हो गया, टेल बोन पेन हो गया, स्लिप डिस्क हो गया। हील पेन्स आर सो कॉमन। पोस्ट डिलीवरी बहुत फीमेल्स आर स्ट्रगलिंग। मेनोपॉज आ रहा है तो दिक्कत है, और मेनोपॉज खत्म हो मतलब हो गया है शुरू, इट्स बीन नाउ 8-10 years, फिर प्रॉब्लम्स आ रही हैं। lot of men, they are struggling with their workstation challenges, pains आ रहे हैं। ऑल्सो लॉट ऑफ मेन दे फेस एजिंग इश्यूज की एज के साथ प्रॉब्लम्स आ रही है, या फिर ओवर यूज हो रहा है, या रेस्ट करने का टाइम नहीं मिल रहा है, या फिर ऑलरेडी लाइफस्टाइल डिसीजेज है जैसे डायबिटीज है, हार्ट डिसीजेज हैं, उनके साथ बॉडी रिपीटेड हॉस्पिटलाइजेशन है या रिपीटेड मेडिकेशंस हैं, जिसकी वजह से बॉडी और जॉइंट्स और मसल्स वीक हो रहे हैं। lot of patients I'd say about especially कोविड के बाद, चिकनगुनिया, डेंगू के बाद बहुत कॉमन प्रॉब्लम्स है। पीपल स्टिल से कि साल 2 साल पहले हुआ था पेन, अब वो कंटिन्यूस ही रह रहा है, खत्म नहीं हो रहा। देन देर आर पीपल हु से कि क्रॉनिक वायरल्स हो रहे हैं, बहुत बार बुखार आ रहा है, उसके बाद से दर्दें क्रॉनिक रह रही है, स्पेशली विद द एजिंग पेरेंट्स आई शुड से। पेरेंट्स के साथ भी कहीं ना कहीं ये हम लोग सुनने में आता है कि अब हम बाहर घूमने नहीं जा सकते बिकॉज पेरेंट्स घर में बिल्कुल मूव नहीं कर पा रहे हैं बिकॉज ऑफ देयर पेन्स और एजिंग प्रॉब्लम्स। बोले तो सबसे पहले पेन्स ही सामने आती है, या लिमिटेशन, वो अब मम्मी को लेके नहीं जा सकते बिकॉज वो चल नहीं सकते, या मेरे फादर ट्रैवल नहीं कर सकते हैं, उनके लिए थोड़ी ऊंची कार चाहिए। सो दीज आर सम प्रैक्टिकल इश्यूज जो हम हर घर में ये प्रैक्टिकली देखते हैं। अच्छा, मैं एक चीज और देखती हूँ कि आज मतलब अपने ये 20 years के करियर में मैंने एक नोटिस किया है कि पीपल हैव स्टार्टेड कीपिंग पेन किलर्स एज फर्स्ट एड। मतलब एक टाइम था बैंडेज, सोफ्रामाइसिन या फिर डेटॉल या इस तरीके की फर्स्ट एड की चीजें होती थी, लेकिन अभी रिसेंटली पेन किलर्स, एंटासिड्स और मसल रिलैक्सेंट्स बहुत कॉमनली लोगों ने रखना शुरू किया है, बिलीविंग दैट कि दो तरीके के पेशेंट्स है। एक कहते हैं हमें पता है इसके साइड इफेक्ट्स है बट हमारे पास कोई ऑप्शन नहीं है अपने दर्दों से फ्री होने का। सेकेंडली देयर इज अ ग्रुप ऑफ पेशेंट्स हु से कि मतलब यस, हमें इंस्टेंट रिलीफ मिल जाता है, हमारा काम चल जाता है, फिर क्या हुआ, कोई बात नहीं, थोड़ा बहुत पेन किलर्स लेने से कुछ नहीं होता। और कहीं ना कहीं वो पेन किलर्स के लिए वो एक उनका वो बिलीफ सिस्टम बन गया है कि चलो ये कोई लाइफ थ्रेटनिंग तो है नहीं ना, पेन किलर्स को लेके दे कीप मूविंग। क्योंकि कहीं ना कहीं जब ये पेन्स का इशू आता है तो जो फर्स्ट सबसे पहले हमारे घर में क्या प्रैक्टिस होती है, होम रेमेडी स्टार्ट होती है कि मूव लगा ली, वॉलिनी लगा लिया, कुछ मसाजेस करा ली, या फिर अगेन हमने कोई नी कैप पहन लिया, सर्वाइकल कॉलर पहन लिया, या हमने लंबर बेल्ट पहन लिया, या हमने कोई ऐसे स्पेसिफिक टाइप का जूता लिया जिससे हमारा हील पेन, फुट पेन कम हो जाए। आई हैव सीन स्पेंडिंग पेशेंट्स लॉट एंड लॉट ऑफ मनी ऑन देयर मैट्रेस एंड बेड्स। मतलब एक अच्छा वाला मैट्रेस मिल जाए जिससे बैक पेन चला जाएगा। तो ये सबसे पहले होम रेमेडी तो यहाँ से शुरू होती है। जब इन सब चीजों से भी आराम नहीं आ रहा तो सेकेंड थिंग व्हाट यूजुअली पेशेंट्स डू, वो सब काम करना छोड़ देंगे जिससे उनकी दर्द बढ़ती है। जैसे मैं सीढ़ियां नहीं चढ़ूंगी, मैं नीचे नहीं बैठूंगी, या फिर मुझे एक्सर्शन लेने से डर लगता है, मैं ट्रैवल नहीं करूंगी, या फिर अब मुझसे होता नहीं है। एक कंटिन्यूस नेगेटिव फीडबैक अपने आप से, जिससे उनकी मेंटल हेल्थ भी काफी इफेक्ट होती है। क्योंकि एक टाइम था जहाँ पे वो बहुत ज्यादा काम कर रहे थे, और अब एक ऐसा टाइम है कि जहाँ पे वो बिल्कुल भी अपनी खुद की सेल्फ केयर के लिए भी, जैसे नहाना धोना, ब्रशिंग करना, ड्रेसिंग एंड ड्रेसिंग में भी चैलेंज फील कर रहे हैं। और मैं ये चीज ये नहीं बोलूंगी दिस इज जस्ट रेस्ट्रिक्टेड लिमिटेड टू हमारे पेरेंट्स, ये कहीं ना कहीं आजकल यंग एज या एडल्ट्स में भी से एज अर्ली एज 35-40 ईयर्स के एज ग्रुप में भी ये इश्यूज बहुत कॉमन हो रहे हैं। एंड रिसेंटली कोविड के बाद से तो मैं देख रही हूँ कि बच्चे यंगस्टर्स जैसे 12, 15, 20 साल के बच्चे भी बहुत कॉमनली बैक पेन नेक पेन्स लेके आ रहे हैं। सो ओवरऑल पेन किलर्स से लेके जब हम किसी दर्द को ढकने की कोशिश करते हैं, तो दिस इज द बिगेस्ट रीजन कि पेन जीरो नहीं होता। और पेन किलर खुद ही कह रहा है कि मैं पेन किलिंग करता हूँ, हीलिंग नहीं करता हूँ। तो जैसे मैंने भी बताया कि सबसे पहले मूव वॉलिनी लगाया, नहीं आराम आया, फिर देन हमने एक इकोसिस्टम बना लिया लिमिटेड मूवमेंट्स का। कुछ कुछ चीजों का लिमिटेशन तो हमने खुद बना लिया, जैसे ऊपर नहीं चढ़ना, या मुझे एक सपोर्ट चाहिए, या मैं ग्राउंड फ्लोर पे रहूंगी, या फिर अगेन वॉकिंग स्टिक ले लिया, वॉकर ले लिया। कुछ लिमिटेशंस कहीं ना कहीं हमारे हेल्थ एक्सपर्ट से हमें सुनने को मिलता है कि अब आपको बैक पेन हो गया तो आपने झुकना नहीं है, आपने वजन नहीं उठाना है, आपने नीचे नहीं बैठना है। तो अगेन मैं यहाँ पे एक चीज बोलूंगी कि जितना हम ये इकोसिस्टम ऑफ मूव लिमिटेड मूवमेंट्स, मतलब कम मूवमेंट्स के इकोसिस्टम को हम बढ़ाते जाएंगे, हमारी बीमारी ने बढ़ना है। क्योंकि जॉइंट्स और मसल्स की खुराक मूवमेंट्स है। और मूवमेंट्स मतलब सिर्फ एक्सरसाइज नहीं होता, मूवमेंट्स में हमारी रोजमर्रा की जो हमारी सेल्फ केयर की मूवमेंट्स है, या हमारे घर की रिस्पॉन्सिबिलिटीज है, या हमारे वर्क स्टेशन पे जो रिस्पॉन्सिबिलिटीज है, उसके साथ जो मूवमेंट्स चाहिए, वो भी इक्वली इंपॉर्टेंट रोल प्ले करती है। तो इसीलिए हमें यहाँ समझना इस वेबिनार के थ्रू बहुत जरूरी है, इस टॉक के थ्रू, कि पेन हमारा फ्रेंड है, पेन हमारा दुश्मन नहीं है। जैसे हम लोग आजकल हर घर में सीसीटीवी कैमरास लगाते हैं कि हमारी सिक्योरिटी हो। आजकल अलार्म सिस्टम का कॉन्सेप्ट हो गया है घर में कि कोई अगर गलत बंदा आ रहा है या कोई गलत व्यक्ति एंटर कर रहा है, तो हमारे घर के अलार्म सिस्टम्स एकदम से एक्टिव हो जाते हैं, वो हमें इन्फॉर्म करते हैं कि दिस इज समथिंग रॉन्ग। अनदर एग्जाम्पल आई वुड लाइक टू शेयर हियर, जैसे हमें बुखार हो रहा है, अगर इन्फेक्शन है तो बुखार हमारा फ्रेंड है ना, इट इज इन्फॉर्मिंग अस कि इन्फेक्शन हो गया है। मान लीजिए एक बुखार है, एक इन्फेक्शन है विदाउट बुखार, और एक इन्फेक्शन है विद बुखार, तो ऑफ कोर्स विद बुखार इज ऑलवेज बेटर, क्योंकि आपको समझ आ रहा है कि कुछ गलत हुआ है अंदर। ऐसे ही मान लीजिए हार्ट अटैक विद पेन एंड हार्ट अटैक विदाउट पेन। अगर विदाउट पेन है तो इट इज सो डेंजरस, पर्सन कैन लूज हिज लाइफ, एक डेथ भी हो सकती है। पर अगर हार्ट अटैक विद पेन आ रहा है तो हम इमीडिएटली डॉक्टर के पास पहुंच सकते हैं, और अपनी प्रॉब्लम बता के वी कैन इमीडिएटली टेक केयर, तो उसके लेट कॉम्प्लिकेशंस नहीं होंगे। एंड इट इज वेरी इंपॉर्टेंट टू हैव दिस अलार्म सिस्टम एक्टिव इन अ बॉडी। बट जब जॉइंट्स और मसल्स की पेन की बारी आती है तो हम लोग उसको बहुत नेगेटिव पिक्चर लेते हैं, कि मुझे पेन्स हो रहा है ये अच्छी बात नहीं है, या ये बहुत गलत हो रहा है, या पता नहीं मेरे साथ ऐसा क्यों हो रहा है। लॉट ऑफ पीपल स्टार्ट बिलीविंग कि मेरे कार्मिक अकाउंट्स हैं, या मैंने अपनी केयर नहीं करी। लॉट ऑफ थिंग्स माइट बी ट्रू, बट कमिंग बैक टू द टॉपिक, पेन आपका फ्रेंड है। आज इस टॉपिक से जरूर इस बात को एक्सेप्ट करने की कोशिश करें, क्योंकि जॉइंट और मसल्स के पेन भी आपको इन्फॉर्म कर रहा है कि कुछ गलत है, कुछ अंदर प्रॉब्लम है जिसको हमें एड्रेस करना है। और अगर वो पेन मुड़ मुड़ के आ रहा है, तो ये भी हमें ध्यान देना है कि हम कहीं ना कहीं रूट कॉज पे काम नहीं कर रहे हैं। जैसे मान लीजिए बुखार आया, तो हम लोग सब पहले एक यूजुअली ठंडा पट्टी या कुछ इस तरह से घर में करते हैं जिससे बुखार उतर जाए। जब आराम नहीं आता है तो डेफिनेटली हम लोग हमारे जनरल फिजिशियन को मिलते हैं, डॉक्टर को, फैमिली डॉक्टर को मिलते हैं कि मेरा बुखार नहीं उतर रहा है। वो आपको कुछ टेस्ट सजेस्ट करते हैं जिसमें हम ये पहचानने की कोशिश कर रहे हैं कि ये बुखार का रीजन क्या है। चिकनगुनिया है, डेंगू है, मलेरिया है, देयर कुड बी लॉट ऑफ रीजंस फॉर बुखार। बट जब वहां पे भी आराम नहीं आता, तो डेफिनेटली हम लोग फिर वी चेंज द हायर लेवल ऑफ डॉक्टर, कि हम एमडी मेडिसिन के पास जा रहे हैं, या हम थोड़ा और ऊपर है, जैसे रिस्पेक्टेबल गवर्नमेंट इंस्टीट्यूट्स है, पीजीआई है, एम्स है, या और कोई हायर इंस्टीट्यूट में जाने की कोशिश करते हैं, जस्ट टू आइडेंटिफाई कि रूट कॉज क्या है। हम यहाँ पे समझते हैं कि बुखार बीमारी नहीं है, एक सिम्टम है, और बुखार के इलाज से बीमारी खत्म नहीं होगी। लेकिन पेन जब खासकर जॉइंट्स और मसल्स के पेन होते हैं, या स्पाइन का इश्यू, रीढ़ की हड्डी में दिक्कत आ रही है, गर्दन है या कमर का दिक्कत आ रही है, तो उसमें मैंने देखा है कई बार पेशेंट्स अपने पेन का इलाज करने में ज्यादा ऑक्यूपाइड होते हैं, और कहीं ना कहीं उनकी सोच होती है कि पेन को ट्रीट करने से वी विल फील बेटर। बट यहाँ पे सबसे फर्स्ट मिस्टेक होती है, क्योंकि जब आप पेन को ट्रीट करेंगे ना, तो आप उसकी जड़ पे नहीं काम करेंगे, वो सिर्फ पेन रिलीव करेगा, रिकवरी नहीं करेगा। और रिलीफ की वजह से रिलैप्सेस ऑफ पेन होते रहते हैं। अक्सर पेशेंट्स में देखा गया है कि जी पहले कभी कभी दर्द आता था, या फिर यूजुअली पेन जो है वो एक स्टिफनेस के फॉर्म में भी आ सकता है। पेन जो है वो डिस्कम्फर्ट, जैसे झंझनाहट होना, सुनपन होना, या फिर पेन, सिंपल भाषा में बोलूं तो लिमिटेशन ऑफ मूवमेंट, कि पहले मुझे कोई काम करने में 10 मिनट लगते थे, अब मुझे वही काम करने में आधा घंटा लगता है। मे बी मैं अब डिपेंडेंट हो रही हूँ अपने हेल्पर्स के ऊपर, या मुझे ज्यादा मेड्स चाहिए, या जैसे मैंने देखा है जिन लोगों को बैक का इशू है तो वो जल्दी से ड्राइवर, दे विल फाइंड आउट कि मेरे को ड्राइव नहीं हो रहा है तो आई नीड अ ड्राइवर। या फीमेल्स यूजुअली घर में जब उन्हें कोई दिक्कत आ रही है तो दे वांट मोर हेल्पर्स, कि मुझे अब होता नहीं तो ठीक है हेल्पर्स का सपोर्ट लूं। अच्छा, यहाँ पे मैंने कहीं ना कहीं कुछ बच्चों का एक इस तरह से एटीट्यूड भी देखा है कि पेरेंट्स को दिक्कत आ रही है तो दे विल से कि आप मत करो, आपको क्या करने की जरूरत है, ये तो वी कैन अपॉइंट अ मेड, या आप अननेसेसरी अपने आप को इन्वॉल्व करते हो, आपको ज्यादा काम नहीं करना चाहिए। बट वेरी इंपॉर्टेंटली, हम सब जानते हैं कि बढ़ती उम्र के साथ शरीर का चलते रहना जरूरी है। चलते रहने का मतलब होता है पेन फ्री, पेन में नहीं। तो कहीं ना कहीं पेशेंट भी जो होते हैं हमारे पेरेंट्स एज ग्रुप में, वो अक्सर ये कहते होते हैं कि, या आजकल मैं इवन 40 इयर्स प्लस में भी ये प्रॉब्लम्स देख रही हूँ। हम सब जानते हैं कि हम जैसे जैसे 40 प्लस क्रॉस कर रहे हैं तो हमारे शरीर के मूवमेंट्स और ज्यादा जरूरी है हमारे वाइटल्स को मेंटेन करने के लिए, जैसे ब्लड प्रेशर है, शुगर है, या हमारे वेट है, कोलेस्ट्रॉल है, उनको मैनेज करने के लिए। बट जब हम ये सुनते हैं कि अब आप मूवमेंट्स ना करो, तो एक वहां पे कंफ्यूजन क्रिएट होता है। अब इस बात में मुझे रिसेंटली याद आता है, मेरे पास एक पेशेंट आ रही थी एंड शी वाज बिट ओवरवेट, डायबिटिक भी थे, काफी उनका फुट पेन था डायबिटीज की वजह से, और प्लस वैसे भी उनके जनरल जॉइंट पेन्स थे। तो जब वो अपने जनरल डॉक्टर को, डायबिटीज के डॉक्टर को मिलते थे, वो उन्हें इंसिस्ट करते थे आप चलते नहीं हो, आप मूवमेंट्स नहीं करते हो, आप थोड़ा एक्टिव रहो। पर वो सिमिलरली जब अपने एक दूसरे हेल्थ एक्सपर्ट ऑर्थोपेडिशियन को मिलते थे तो वो उन्हें कहते थे आपने अब चलना क्यों है, आप अपने मूवमेंट्स कम रखो, ध्यान रखो, आपका इतना अच्छा परिवार है, केयरिंग परिवार है। तो शी यूज्ड टू आस्क मी कि मैंने करना क्या है, आई एम अनेबल टू अंडरस्टैंड कि मैं अपनी पेन्स की सुनूं या मैं अपनी डायबिटीज की सुनूं। तो ये सिनेरियो बहुत सारे लोगों के साथ बनता है कि दे वांट टू मूव बट दे आर अनेबल टू मूव बिकॉज ऑफ देयर पेन, स्टिफनेस, देयर लिमिटेशंस। सो जैसे मैंने बताया कि मूव वॉलिनियाडिक्स का काम हो गया। अच्छा, फिर उसके बाद नेक्स्ट स्टेप हमने वो सारी मूवमेंट्स करना छोड़ दी जो हम करना चाहते थे, और हमने एक इकोसिस्टम बना लिया। एंड थर्ड, वेरी इंपॉर्टेंटली, देन नेक्स्ट स्टेप आता है कि हमने डिफरेंट हेल्थ एक्सपर्ट्स, हम, मैं इसको डॉक्टर शॉपिंग बोलूंगी, कि हम मल्टीपल हेल्थ एक्सपर्ट्स को मिलना शुरू करते हैं। अब इसमें यूजुअली जो हमारे इंडिया में कॉन्सेप्ट है, मीटिंग एन ऑर्थोपेडिशियन, देन न्यूरोलॉजिस्ट हो गए, या फिर आयुर्वेद प्रैक्टिशनर्स हैं, होम्योपैथ प्रैक्टिशनर्स हैं, नेचुरोपैथी है, एक्यूप्रेशर, एक्यूपंक्चर, ऐसे हमारे पास इंडिया में बहुत सारे रिसोर्सेज है जिसके थ्रू हम पेन फ्री हो सकते हैं। और ये एक्सपर्टीज बहुत बार हेल्प करती है, नो डाउट अबाउट इट। बट देयर इज अ ग्रुप ऑफ पेशेंट्स हु स्टिल सफर विद दिस पेन, मतलब वो दर्दें उनकी चलती रहती हैं हेल्थ एक्सपर्ट्स को मिलने के बाद भी। तो अक्सर होता है कि आप, जैसे ये बीमारियां यूजुअली स्लिप डिस्क हो गई, sciatica हो गया, वेरिकोज वेन्स का प्रॉब्लम है, या फिर कह लीजिए माइग्रेन का इशू आ रहा है, या फिर आ रहा है हमें कोई स्टिफनेस का इशू आ रहा है। अब इसका जो फर्स्ट लाइन ऑफ ट्रीटमेंट यूजुअली जो हेल्थ एक्सपर्ट स्टार्ट करते हैं, दैट इज पेन किलर, एंटी इन्फ्लेमेटरी, देन देयर इज समथिंग नोन एज कैल्शियम विटामिन डी का सपोर्ट, सप्लीमेंट्स दे दिए, या फिर उसके बाद आता है रेस्ट दे दिया। तो उसके बाद एक एक्सरसाइजेस पे बहुत जोर डाला जाता है। तो क्योंकि एवरीवन नोज की जॉइंट और मसल्स की खुराक एक्सरसाइजेस है। प्रॉब्लम क्या आती है कि मैं उस कैटेगरी ऑफ पेशेंट्स के लिए बात कर रही हूँ जिन्होंने ये सब कुछ किया पर उनका पेन का विशियस साइकिल बन रहा है, उनकी मूवमेंट्स कम हो रही है, उन्हें दिक्कत बार बार आ रही है। जिनका इससे काम बन गया है, दे आर रियली डूइंग गुड। क्योंकि मैं हमेशा बोलती हूँ कि अगर आपको जज करना है कि आपकी रिकवरी या रिलीफ है, तो आपकी मूवमेंट्स बढ़नी चाहिए, मूवमेंट्स घटनी नहीं चाहिए। अगर आपकी प्रिकॉशंस, कि मैं, मेरे नहीं करने वाली मूवमेंट्स के प्रिकॉशंस का दायरा बढ़ रहा है, उसकी क्वांटिटी बढ़ रही है, नंबर ऑफ मूवमेंट्स की लिमिटेशंस कम हो रही है, मतलब लिमिटेशंस की, अब मैं ऊपर भी चढ़ सकती हूँ, नीचे भी बैठ सकती हूँ, तो इसका मतलब आप ठीक हो रहे हैं। पर अगर वो कम हो रही है तो इसका मतलब आप रिलीफ जोन में हैं। तो जिन पेशेंट्स को ये सब कुछ करने के बाद भी दिक्कत आ रही है, तो वो अक्सर क्या करते हैं, एक तो होता है सेट ऑफ पेशेंट कि जहाँ पे वो एक्सरसाइजेस के लिए बहुत सारे ऑप्शंस है मार्केट में, जैसे योगा हो गया, जिम हो गया, फिजियोथेरेपी होगी, या फिर हम लोग एक यूजुअल स्विमिंग हो गया, स्पोर्ट्स को ले लिया, या कहीं ना कहीं घर के काम बढ़ाने की कोशिश करते हैं। तो अगेन हमने यहाँ समझना है कि क्या मैं एलिजिबल हूँ एक्सरसाइजेस के लिए, क्योंकि यहाँ पे भी एक सबसे बड़ा कंस्ट्रेन आ रहा है कि जब वो एक्सरसाइज एडवाइस की जाती है तो मोस्ट ऑफ द टाइम पेशेंट्स सेल्फ एक्सरसाइज मोड में आते हैं। कहीं ना कहीं हमने गूगल से पूछ लिया, या कोई फ्री ऑनलाइन और योगा क्लासेस चल रही हैं, या कोई प्रमोशनल जिम सर्विसेज मिल रही हैं, या फिर कहीं ना कहीं हमारे ही, हमें किसी ने एडवाइस किया है कि उन्हें वो पर्टिकुलर एक्सरसाइज करने से फायदा मिला। तो दिक्कत क्या आती है कि जब आपने ये चीज पहचानी नहीं कि आपके लिए कौन सी एक्सरसाइज ठीक है, या आप एलिजिबल भी है कि नहीं इस एक्सरसाइज के लिए, वो बहुत जरूरी बात है। मैं अब यहाँ पे कुछ चीज दिखाती हूँ। मैं अपना ये स्क्रीन शेयर चालू कर रही हूँ एंड आई एम शेयरिंग स्क्रीन। आप इसमें देखिएगा। ओके, आई होप इट इज विजिबल टू एवरीवन।
Yeah, it is done.
तो अब मैं इसमें कैन यू सी
हाँ जी, हाँ जी।
टू एवरीवन?
Yeah,
उनका आगे नहीं बढ़ रहा है।
right, Dr.
इज
Harshni,
इट
it is
विजिबल टू
visible.
एवरीवन?
Yes, yes, it is visible. Dr. Harshni, are you able to hear me?
ये दिख रहा है सबको?
हाँ जी, आपको
ओके,
मेरी आवाज आ रही है?
तो कमिंग।
हाँ जी।
ओके, सो जब मैंने ये बात बोली कि जहाँ पे हम नेक्स्ट आगे नहीं जा रहे ना? अच्छा, ओके। ओके, तो मैं इस स्लाइड के बारे में बात कर रही थी, जो मैंने अभी आपको चीजें बताई कि किस तरह से हम लोग पेन को स्ट्रगल करते हैं। अब जो हमारा जो नेक्स्ट नेक्स्ट पर्सपेक्टिव होता है, जो मैंने अभी पेन किलर्स के बारे में बताया कि किस तरह से हमें एक एडवाइस मिलती है और हम लोग उसे फॉलो करते हैं, और काफी पेशेंट्स को आराम भी मिलता है, लेकिन काफी पेशेंट्स होते हैं जो स्ट्रगल करते हैं। इसमें एक लास्ट बात लिखी थी, जब इसके अलावा अक्सर पेशेंट को कहा जाता है कि डोंट टेक स्ट्रेस। अब मैं समझती हूँ स्ट्रेस ऐसी चीज है जो इट्स इम्पॉसिबल इफ वी आर इन ह्यूमन लाइफ कि हम स्ट्रेस के बगैर रहें। स्ट्रेस तो आएगा, डेफिनेटली। हमारी कैपेसिटी कितनी है स्ट्रेस को लेने की, वो हमारी इंडिविजुअल सिचुएशन आएगी जहाँ पे हमारी स्ट्रेस लेने की काबिलियत तो है, लेकिन कहीं ना कहीं हमारी फिजिकल पेन्स हमें वो स्ट्रेस लेने में इनकेपेबल करती हैं। जैसे मेरे पास कुछ पेशेंट्स हैं, वो कहते हैं, जो वर्किंग है खासकर, जिनका वेरी हाई स्ट्रेसफुल मेंटल लेवल पे काम है, जो हमारे आईटी प्रोफेशनल्स हैं, बैंकर्स हैं, या देयर आर अगेन अ लॉट ऑफ पीपल फ्रॉम अदर कम्युनिटीज। तो वो कहते हैं कि हम काम सब कुछ ले सकते हैं, अगर मेरी गर्दन ठीक हो जाए, मेरी गर्दन ठीक रहे, सर्वाइकल पेन ना आए, मेरे को हेडेक ना आए, मुझे बैक पेन नहीं आए, तो मैं कितनी भी अमाउंट का काम कर सकता हूँ, मुझे कोई दिक्कत नहीं है। बट ये दर्दें जो मुझे रोकती हैं मेरे ट्रैवल प्लान्स को बनाने में, या फिर मेरे को एक्स्ट्रा काम लेने में, या मेरे प्रमोशंस को लेने में भी। अब जैसे मेरे पास कुछ पेशेंट्स हैं जो काफी सीनियर लेवल पे गवर्नमेंट ऑफिसर्स हैं, और वो कहते हैं हमने प्रमोशन को इंटेंशनली अवॉइड किया, इवन तो वी डिजर्व, जिसके लिए हमने इतने साल काम किया, बट वी डोंट वांट टू टेक दिस प्रमोशन बिकॉज अब हमसे होता नहीं है, क्योंकि बहुत पेन्स है। तो जब ये लिमिटेशन आ रही है, इट दैट अगेन शोज कि आप पेन रिलीफ जोन में, आप पेन रिकवरी जोन में नहीं है। तो जब मैंने ये कहा कि ये सब कुछ करके भी आराम नहीं आ रहा, तो इसमें फिर दिक्कत कहाँ आ रही है? सबसे इम्पोर्टेंट बात है, जैसे आपके कैल्शियम विटामिन डी भी हड्डी में डिपॉजिट होता है, मूवमेंट्स जॉइंट पे आती है। हर चीज घूम फिर के जॉइंट, स्पाइन और मसल की मूवमेंट पे डिपेंडेंट होती है। जितनी आपकी पेन फ्री और एक अच्छी मूवमेंट, हेल्दी मूवमेंट, अब हेल्दी मूवमेंट की डेफिनेशन पे मैं आऊंगी जब मैं ट्रीटमेंट की बात करूंगी, बट ये
Doctor,
हेल्दी। हाँ जी।
Dr. Harshni, if we can also use English because few participants have
ओके,
joined who don't understand Hindi much.
okay, okay. So, when we talk about calcium, vitamin D consumption as a supplement for joint and muscle pain, the absorption of these supplements will also depend on how much movement you are doing, because it is the demand and supply role in bone. Bone performance increases if the demand is high in terms of movement. So, definitely, the more movements are there in bone, the desire of bone to absorb calcium from your nutrition, from whatever you have taken, also increases, and that is where your bone becomes a strong structure. But usually, in the lack of movement, absence of movement, or reduced movement because of painkillers, then it also affects the metabolism of calcium and vitamin D absorption in the bone. So what I'm trying to say is that a lot of people believe that we have taken calcium vitamin D. At times in the initial period of their pain, they become happy also. Yes, I'm getting benefit with the calcium and vitamin D. But after a certain number of months or years, they realize that these supplements are not even helping me to any extent, and they keep on rotating their supplements from different countries, or say different health experts, and the vicious cycle of medications then increases. Similarly, a lot of people, they believe that certain postures, if I'm not following a good postural habit, then again I'm victim to these pains. I agree. Practicing good postural habits is very important part of your living in pain free. But it is not practically possible to stay and follow good postures every time. It is again the stress factor, lack of sleep. There are a lot of things going on parallel. And especially with the working mothers, also, I say there are a lot of practical, genuine reasons they are unable to follow good postural habits. But is our spine and joint such a delicate darling that if we are not able to follow on some particular days good postural habits, so we should get pain? This is a very important question which we need to scroll in our head. Then third is like a lot of patients say me that I've been trying a lot of different versions of exercises, but a group of patients say ki yes, I'm able to get benefit of exercises. Okay, enjoy. Second group of patients says I've tried everything on this earth in every form of exercise or version of exercise, but I'm not pain free. The third vertical of patient says I'm unable to do exercise because I'm in pain. So that says ki they are not able to take the exercise as medicine. So here the important role arises ki exercise as a medicine, exercise as a food, and am I eligible for exercise? These are three different topics. So before deciding and choosing exercise, we really need to shuffle our head that am I eligible also? How you can judge? I will come to the next slide. So, and the last when I said don't take stress, which is not practically possible. So yes, can I be pain free even in stress? So please keep this question in your head because I'm soon coming to the answers also. But when all these things, when it doesn't work, then the next question arises, do I need an injection? Should I think about knee replacement surgery? Should I plan for spine or a shoulder surgery? These days, recently, last since 2, 3 years, I have been seeing such a big change in patient belief system in treating knee pain, especially, or even the back pains. So when they enter my OPD, they ask me, Doctor Saab, I have knee pain. Do I need a surgery? And I am like, you are here for the knee pain. You have come to me to get rid of knee pain. Who has told you that only surgery is the solution? Because they say ki I have tried a lot of doctors or I have tried a lot of health experts. I have been really working hard on my knee. It is not responding to the treatment. That's why I believe that I need a surgery. So can you do something magic? Now I have to make them understand. See, not all knee pains are because of your knee. Like how we get a referred pain of heart into our arm. Similarly, the knee pain can be because of your spine, or it can be maybe some other issue in your hip joint or an ankle joint. Also, a very important thing which you need to remember, my audience, that no movement happens with one structure or no pain in joint or spine is happening because of one structure. Like people with back pain, they will come to me, Doctor Saab, I have some problem in L5S1. So now they have been asked to take an extra MRI. And an MRI, some reports come with that there is some prolapse of vertebra or there is some listhesis or there is some spondylitis changes, or there are some other nerve compression seen in the X-rays and MRI. But we tend to forget in the end of report, they are mentioning please correlate clinically because the details mentioned on the MRI, CT scan and X-rays are just supportive to the diagnosis. They are not the real diagnosis. So again, if the diagnosis was supposed to be made by a radiologist by seeing MRI, the scans, then radiologist is enough to declare your disease. But the radiologist is not the right person to declare or diagnose your disease. He's just giving you supportive tool to come to some conclusion of your problem or the resource of your problem. So again, remember, please, from the next time, whenever you see some X-ray in which you see a knee in a very bad shape, like bone on bone, or you see a very reduced joint space, or you see a disc prolapse, so don't panic because after 20, 21 years of age, if I'm going to take X-ray or MRI of any person, they are going to show these changes like whitening of hairs, like graying of hairs, then the degeneration of your teeth is not a disease. Similarly, the changes seen on your X-ray MRI is not a disease. Okay? It may or may not be responsible for your discomfort. That is what we need to identify through clinical examination. Once it is ruled out that yes, this is the picture, these are the resources, then definitely the right treatment can be decided. Another very common aspect, what I've seen, people do say that surgery should be the last option. Okay, very clear in your head. Then what is the first option? Okay, medications and multivitamins and exercises, but it is not helping me. So what is the reason why it is not helping me? Reason, as I mentioned to you, movements are equally important for this conservative line of treatment to get effective. Now, if your exercises are not helping, then another question should arise: am I eligible for exercise? How should I understand the eligibility, and how should I become eligible if I'm not eligible? That is where I'm going to focus on the next slide, because the next slides will help you to understand that yes, my treatment wasn't done complete or was inappropriate, because it could have been a referred pain or local tissue in which I need to address a lot of structures. Like, for an example, a patient coming to me with a back pain and talking about disc prolapse, I have to make them understand that your back, lower back, or upper back, or cervical area, it performs with the help of muscles, joints, disc, ligaments, and nerves. All structures in coordination when they perform, that is where you get a strong back, and that is where you perform a movement, because it's a robust structure. It is made to take load and movements both. Now, just addressing one structure which you think was responsible for your pain won't make your back strong. Similarly, addressing just one structure that, yes, the joint space is less, or the arthritic changes are quite visible, or the grease is less in the knee, the commonly used word. So, it is not the only structure which is giving you pain. So, because the movement in the knee is also happening with the muscles, ligaments, every structure, na? So, we need to work on the every structure. How come only one structure you address and then you can enjoy a recovery? So relief is possible through one structure, recovery is possible when you work on all the structures. Now, how you can work on this? So coming to the next slide. This I've already mentioned that finding the right expert is at times a challenge for a lot of patients, and they keep on trying with different expertise just to get pain free. Thought in their head is, I want pain recovery. But many a times they just come across pain relief. They're not able to see the version of recovery. So that is another thing where I talk about the pain rehab expert. If you see here, I've mentioned in the lower slide, uh, the pain rehab expert is also one of the expert who can help you on this. Who is this? I will talk on that later. Now, coming on this slide, if you see, I have mentioned a VAS score, visual analog scale. So how I've used the example of fever. Whenever the fever happens to us, we always use a thermometer to check how much fever I have. And even before going to doctor, we check this fever. Once we land up with the doctor, we inform him that I'm having 101, 102 grade ka fever. And matlab we people are so much aware of this, finding out the parameter of fever, how bad it is. But with pain, usually patients, they come to me and then they say it was a mild pain, थोड़ा थोड़ा दर्द है, ज्यादा ज्यादा दर्द है, medium दर्द है, or they will say it's a severe pain. Now this mild, medium, and severe, all these three words sound so vague. It is so hard for the doctor to understand, because my mild could be moderate for you, your moderate may be severe for some other patient. So that's why WHO has made it mandatory to use this VAS score for all the health experts, so that they can ask their patient and the patient can inform to the doctor that what kind of and degree of pain he is suffering. Now, I will ask all the audience, please screenshot this, please take a photo of this slide, take out a printout, stick at home, make your family, your relatives, and near dear ones to understand how to declare your pain once you reach to your doctor. Like I've mentioned, 0 to 3 is no pain or mild pain, 3 to 6 is something moderate or severe. Now, if I talk about 5 to 8, how to differentiate between severe and very severe? Like when I talk about 3 to 5, that yes, there are some limitations of movement, not majorly my movements are affected. Pain does remind me every time, but 5 to 8 reminds me that my pain might worse. I need a painkiller, which I'm trying to avoid. And 7 to 10 says that I'm not getting any help from any form of medication. I really am unable to get any kind of help from any doctor. So now, whenever you are talking about your pain, you should be able to talk in terms of this figure. It becomes very easy for the health expert to understand the limitation of movement due to pain. So you help your doctor in understanding your problem. I hope everyone has taken the click of this. Should I move to the next slide?
Yes,
Should I move to the next slide? If you've
yes,
taken the picture?
yes.
Okay. Now, coming to the reason of pain. So when I talked about recently, I spoke about that your knee pain can be a referred pain from your spine. Your Back pain can be a referred pain of your neck. What does referred means? Referred is a medical terminology. So if I use a simple example, maybe some particular light in a bedroom is not working and you keep changing your bulb. Doesn't work. Okay, then again the bulb gets damaged. Then you try to check at the back end why the bulb is not able to work or why it is getting spoiled. Then you check at the transformer level, or maybe you try to check at the fuse level that there is some problem at the fuse or some transformer level. So again, you're trying to work that the problem may be at the transformer, which I need to rectify, and my bulb will start functioning and won't get damaged again. Similarly, with the joints, one should always identify the problem is sitting in the local area or it is sitting in the some other area. So some other area means, like in the picture, can you see there is some level discrepancy in the shoulder, and it is causing an unequal weight bearing on the knee and the hip joint. And this is where something the people they really face. Uh, these are some malalignments at the spine and the other joint level. So if you are not able to address these issues, and these are very, very common, and honestly speaking, this can be well judged by the pain rehab expert because they work on the functional recovery. There is something known as structural recovery. So when I talk about structural recovery, see, a lot of people say my joint space is reduced or my disc is now out. How can I recover? That structure is already out. So now I should say, uh, like if your joint is already the joint space is less, there are a lot of patients who do have this bad knees, but they are asymptomatic. They don't have symptoms. There are a lot of patients who have a lot of disc, slip disc issues, but they are not at all into pains. Okay? So not essentially the structure seen in your x-ray might trouble you. And also in certain cases, if they're even troubling, then also we can really work hard on the supporting structures of the joint. Like I usually use an example of a tent. So when you place a tent, the cloth of the tent, the ropes of the tent, the nails of the tent, everything is keeping that tent in place. So similarly, we can work a lot on the alignments, functional alignments through manual therapy, hands-on therapy. By correcting these alignments, we can really make you eligible for your exercises, and that is where you can stay pain-free. It is very much possible. Why this sounds unfamiliar? Because this expertise is very, very rare in India. You can find this expertise in certain metros, cities like Mumbai or Bangalore or the bigger cities, or you can see in the Western world. But in small places and most of the part of India, the expertise is very rare, and that's why people are very. A lot of health experts aren't aware of this expertise, though we belong to medical world. But availability of less experts, awareness की कमी की वजह से भी lot of experts are not aware, and they usually miss in prescribing these kind of expertise for rehabilitation. So rehabilitation is always the primary person you should think. If you're not getting pain free or you have been advised for surgery, think about rehabilitation if that helps you, because I always encourage nothing can match original. नी जो हमारा ओरिजिनल होता है, if you go for artificial, yes, artificial knee cannot match the original. Recently there are some studies coming up that getting knee replacement surgery before 60 years of age can be detrimental, because these knee implants also have an expiry date, and they might fall or they might collapse before time. Doing a revision surgery is a very complicated thing, and again, in India, we have very less experts who can do revision knee replacement surgeries. So there are a lot of complications associated with the knee replacement also. Spine surgery तो अपने आप में famous है. It is really famous that it is associated and with a lot of complications. So everyone really knows that yes, spine surgery is not that easy. But the question again arises: do I need surgery? Why I'm thinking of surgery? Can't I improve like this? Because I maybe I've not explored all the options, or maybe I'm not subjected to the complete treatment, the conservative line of treatment. So, message from this video, this picture is that you can see a lot of people they talk about foot pain, especially in diabetes. Especially people they say I have plantar fasciitis or I have heel pain or I have a pain in the early morning. First few steps are very difficult, or after long sitting when I come out of my bed, then I suffer in pain. Can you see if the weight bearing from the top to the bottom is not equal, then one foot is going to cry, or the other foot, both foot are going to cry. Again, the problem is unequal weight bearing. So remember, pain is just a symptom, not a disease. Now I will show you. The picture of this lady, can you see here how bad she had this hunchback? And this she was carrying since childhood days. Again, she had a lot of back pain, neck pain, migraine. The good part was that she could enjoy the recovery part for enough 30 years. She was doing a lot of yoga, walking, everything. But the moment she underwent uterus removal surgery, the hysterectomy, after that she said ki it was really difficult for me to get benefits of yoga. And in fact, day by doing exercises in the form of yoga or some other swimming or something, it was worsening my pain. So she was developing a constant fear of that I can't do exercises. And she was increasing her limitations of movement also. It took me almost a year and a half to bring her to this correction. And now she's totally out of her pains. Even she was advised to correct this hunchback through surgery. So what I'm trying to say, the rehabilitation can do miracles in a lot of cases. And yes, you can be in a pain recovery zone. Now, the biggest challenge in getting pain free, there are some belief systems like a lot of people they want instant relief. आजकल तो जमाना है Amazon और Flipkarts का, you think about it and the Blinkit sends you the article. You think about a food, Zomato delivers you. So everything is instant. So we tend to believe that our pain should also, we should get some instant relief. And that is also which forces us to have a lot of medications. We try to do self-medications. Over the counter, we try to buy some medications. And that actually mask your pain, stops your alarm system, make you more prone of further worsening your symptoms, and it invites more complications. So, trust me, if any joint, muscle, or spine is crying in terms of pain, what I mean to say, the thing has not happened in a day, a week, or a month, or a year. The problem was there from many years. Definitely in the initial years, it was less. Gradually, it became more frequent and more intense, and now it is really bad. We Indians are also sometimes we are like always unless anything really cost us, though we don't pay attention to those things. So when the pain affects your work performance or it really affects your routine activities of daily living like brushing or like taking bath or something, driving, that is where we start thinking of that pain and we really want to come out of that pain quickly. That is the thing where we do the biggest mistake in starting the pain management. So remember, only situations like fracture or some tumor or infection, the pain is immediate. Rest, if you don't have this history, then the pain is not new. It was very much there in the form of some stiffness or weakness or fatigue or tiredness, which we were ignoring or we could able to do by raising our threshold or a stronger willpower. And now the everything body has done its best to support you in pain. Now the body is giving, which it is demanding an attention. So instant relief is not going to really help you in that. It will worsen your problem. Second most common problem, as I mentioned, that a lot of doctors, health experts aren't aware of the specialization of pain rehabilitation. So here I would like to need your have your attention. Like in Western countries, usually whenever the pain episode happens, so there the people can't meet the expert directly. They have to visit a physician, general physician, and the physician guides you that you need an orthopedician, you need a neurologist, or you need a physiotherapy, or you need a pain rehab expert. So, but in India, because we have a very good medical service and a lot of doctors are quite available quickly, so we tend to go to a specialist on the very first point, and at times the expert is really not the right person for us to address our problem. Third important thing is that pain we usually treat very casually because it is not life-threatening. For example, if someone is having some heart or liver issue, so we immediately rush to the doctor. Or I should use an example here, if a child is vomiting and he's not able to take food, so within 2 or 3 days we will rush to the doctor that what's the problem, he's not able to consume food because we know it is life-threatening. But in pain, usually we don't do this. We try some massages, we try some other things. It's okay, we can manage. We try to increase our threshold to absorb pain rather than treating the pain. So this also worsens the root cause of your pain. Then taking pain as a disease, I already mentioned that we treat fever as a symptom, but we treat pain as a disease and we run after treating pain, not finding the resource. Also, for some people, getting pain free, it seems to be them as a dream or impossible. They say, pain से free कैसे हो सकते हैं? Pain तो रहना ही है. They believe that pain is going to be there with them always. and they have their own belief system of aging or winters or rainy season, or maybe I've done some exertion and that's where the pain is not going. Because I believe neither you can stay away from winters if you're in India. Even in the Western countries, you can't stay away from pain because you can't stay away from rainy season, you can't stay away from aging, no, you can't stay away from exertion. So how then you think that ki they are the culprit? Because these things are very common with everyone, but not everyone is into pain. So there are some other myths and fallacies with the pain, like I have to live in pain if I have slipped disc, osteoarthritis, or increased uric acid. So these are again the diagnosis in your findings, but they are not the end to your treatment journey. They are the first step. Yes, this might be the resource of your pain, but with pain rehabilitation, yes, you can be pain free. In fact, in these cases, like especially the autoimmune diseases like rheumatoid arthritis or ankylosing spondylitis, and a lot of series, other names are there, you can be pain free. You should be pain free. You should really work hard to get pain free so that you can do pain free movements and exercises pain free, because pain free movements behave as an antidote and the real ilaj, the real treatment to osteoarthritis and slip disc, because even in cases where the surgeries are done, post surgery also you have to undergo these treatments to enjoy the real improvements through surgery. So why not try before surgery? Why not give a chance to heal, and we may not be needed then surgery. I will stop doing exercise because it increases pain. If you remember in the initial, I have mentioned a score of 0 to 10. So if you fall in the score of 0 to 3 on the VAS score, then you are not eligible for exercises. Sorry, if you're beyond 3 to 4, then you're not eligible for exercises. If you fall in the score of 0 to 3 to 4, then you should again try exercises. If it is not helping, meet your physiotherapist, meet your expert to find out that I'm not able to get the maximum benefits. But the score is beyond 4, maybe 5, 6, 7, 8, 9, 10. Then you're not eligible for exercises. So if I'm not eligible, then what next I should do? So if a child is unable to eat food, you don't stop feeding it. You inquire from your doctor, how should I improve? Doctor works on the resource of the problem, and the child immediately starts feeling hunger. Slow food, small meals, liquid meals, then gradually to the solid meals, and then gradually he might even enjoy the junk food. Similarly, pain rehabilitation expert through advanced manual physiotherapy practices make you eligible for these pain-free exercises. And once you have undergone these kind of treatments, then you should try with the exercises rather than forcing your joint and muscles to do exercises. So again, the remember example, if you will force a child who is vomiting to eat food, he will throw up more. Similarly, if you will force a joint and muscles in pain, then they will throw up more in worsening the problem. Now, a lot of people have seen spending huge amounts on pillows and specific mattresses. They shall lakhs and lakhs on buying ergonomic chairs and a cervical pillow. So here I should advise you, see, mattress does plays a role, but even the simple mattress, cotton wala, which we used to use in olden days, they are also enough fine good. And again, the cotton pillows are enough for the cervical pains. You should use pillow for your cervical thing. If you're finding a difficulty in using pillow, or you face a problem, or you increase your pain with the pillow, so problem is not with the pillow, problem is with your spine, and there is something we need to address on the resource of pain, but not you need to really change your pillows and mattresses, or you need to carry your pillow every time you're traveling, because I've seen so many people in the airports and the trains that they are really I mean taking their extra luggage in the form of pillow and mattress just to stay away from pain. So your spine is not that delicate, darling. Think of fixing your spine rather than carrying your pillows and mattresses and worried so much with your pillows and mattresses. Another thing is no pain, no gain is again the wrong thing. Like a lot of this concept is used on the gym floors, that you have to work hard, you have to push hard to stay from pain, to stay away from pain. So I must tell you here, see, pain is your friend. And if you're on gym floors, or if you're on some other exercise floor, so if you're experiencing some pain on a repeated mechanism, please consult your pain rehab expert or a physio to address this issue. Then people believe that if I won't sit on floor, if I won't bend, I will stay away from pain. Yes, you can enjoy pain-free zones for some years, but if you will avoid these activities for a prolonged duration, then again you have reduced the performance of your joint and the structures which play a big role in your movement, and definitely you are inviting more problems. So a lot of people believe that if I ask someone what you do for exercise, madam, I do a lot of gym. Then someone will say, I go for a walk an hour a day. Or some say, I play a lot at the weekends or on daily basis. I spend 2 hours in my gym or sports activity. So I do exercises. Now I have to make them understand. See how we need a balanced food on your plate. We need some dal, roti, sabzi, salad, everything we need in proteins, carbs, and minerals and nutrition to make it a complete meal. Similarly, in exercises, we need a combination of exercises, some walks, some strength training, some stretching, some range of motion exercises. But again, are you eligible for exercise? That is the first criteria. Second thing, once you are eligible, what kind of exercises you need has to come from the doctor of exercises, that is a physiotherapist. So, a lot of people say, I've taken physiotherapy for 15, 20 days, I feel better. Or they think that stopping physiotherapy, then my pain comes back. So, again, here, if it is happening, then you are into pain relief zone. So, the moment you don't recover from general physician, then you visit a super specialist. Similarly, in physio also, we have a specialization segment. Like I am an MSK physio, musculoskeletal sciences. Musculoskeletal sciences. There is someone into specialty of pediatric physio for children. There is someone in the specialty of sports physiotherapy. There is someone in the specialty of neurophysiotherapy for stroke patients, for delayed milestones children. So you have to identify the right form of physiotherapist also for yourself. But in India, 90 to 95% practice is more in the form of conventional and traditional physio, which many times is enough for pain relief but not for pain recovery. So again, if you are able to do good with your pain relief, as I told you the formula, you are able to increase your movements, your limitations of movement is reducing, then you are in safe hands. But if your movements are reducing and your the uh, pain score is increasing and day by day you are feeling more compromised with your pain, then yes, you need to change your expert. Ask for MSK physio, musculoskeletal physio near around your area who can help you to correct these alignments and make you pain free, not but just not pain free, but also pain recovery. So what this the MSK physio does, I will show you in this slide. This is something known as manual therapy. So it was all forms of biomechanics correction and alignment. So how we have wheel alignment in car, which can, if the alignment of the wheels in the car is affected, then the driver only knows because no one outside can judge by seeing a standing car or a moving car that the wheel alignment is compromised. Only the driver knows or the mechanic knows. Similarly, these joint alignments are important for the performance of your movements. These are the accessory movements which are needed to have a painless and an active life and an active joint movement. These joint alignments are usually missed. As I mentioned, the experts are less, awareness is less, and that's why patient keeps on talking on pain continuously. Now, this form of version of physiotherapy, the super specialty, focuses completely on the manual therapy. Here, the role of machines is very less, and yes, you should really ask your nearest physio to please support you in the form of manual therapy so that these alignments can be corrected, and then definitely you become eligible for exercises, and then you focus on your strengthening stretching programs, whatever has been advised to you, the combination of exercises, and enjoy your joint for till the last breath of your life. This is how promising these treatments are. A lot of people have confusion what is the difference between MSK physio and chiro practitioner. So I should mention here, see, when the problem is really in the initial place, then yes, you can really opt for chiro services also. But yes, if it is not working, then think about pain rehabilitation. See, consult your pain rehabilitation expert so that you can come to the pain recovery zone. Why I'm stressing so many times on recovery, recovery, recovery? Because I want my audience to understand the difference between relief and recovery. Many a times they are just seeing the relief and they are having the dreams of recovery. So believing the relief is the real recovery for them. So just few more minutes I will take and then I'm done. अंगद ये बंद हो गया बेटा. Okay. So a quick information what you can follow at home. Like I've shown a lady how she's sitting on chair. Now if you see the chair closely, it is a very reasonable chair. Hardly it will cost you 5 to 600 rupees. So as I mentioned, people they spend a lot on their chairs and tables. So stop using sofa or bed for sitting. Okay, sofa is for your guest, not for you. Bed is for lying and sleeping, not for sitting. The moment you make your bed as a chair, that is where you start harming your spine and knee joints and the other cervicals and everything. A lot of people they say that by end of the day we are so much tired that we want two, three things to happen together. When we are on bed, we feel relaxed. We can do screen time, we can do some family time. Simultaneously, I'm able to take some rest. But no, it is just a mental rest you are taking. But the bed sitting is going to compromise you a lot. Okay. Then another thing is don't do exercises in pain. As I mentioned you, please increase your eligibility for staying away from pain and you can do an active exercises, but don't force yourself into pain to perform an exercise. Like I've seen people wearing kneecaps and cervical collars and then they keep on doing the exercises or they will wear some particular kind of footwear to avoid their foot pain and they keep on moving, believing that yes, I will feel better on Sunday. Very important part, change your position every 30 minutes, especially people who are into sitting job, because I say sitting is new smoking. Similarly, people who are into standing job, not just the teachers and traffic police people, or whenever even we are at times in malls or in markets or social functions, housemakers, homemakers, housewives, they stretch to stand for long hours, even that is going to worsen your problem because the mobility in the joint, like for say if you're sitting 30 minutes, you can even just stand up for 5 minutes or walk around to improve that mobility at your joint. Make this habit like how we remember that we have to take a break first, we have to take a lunch, we have to take a dinner, or have to drink water at certain duration, after certain duration, or after certain break. So remember, I have to come out of my seat, I have to stand. If I'm standing, I have to sit. If I'm lying, I have to stand. So practice into your daytime once you are awake. That will take care of your joint. So I always say motion is lotion. So when you keep doing this movement, the lotion, the nutrition in the joint keeps on going over there and the joint life increases if you're moving around. But patients I have seen who say after 30 minutes of sitting, I find hard to stand, or if I sit for long, I'm unable to stand and walk. So these are another challenges which can be easily rectified with the help of advanced manual physiotherapy. So this is something just brief about me. And I would love to have more questions from the audience. So please save this tagline: pain is your friend, not your dushman, I should say, not a revenge person with you. And blessing you always. Listen to it, take care of it. And I would like to have questions from the audience now. This is, I'm just sharing my number in case if you want to know something more on a personal front, then you can even drop a message on this number. But here in the webinar itself, I would love to answer some questions because some questions and answering your questions might be an answer to the other people.
Yeah, so audience, if anyone has any questions, you can type in chat or maybe you can raise your hand. I can unmute you.
I can't hear you, Varundeep.
So you are not, I'm not audible to you.
Not audible. उनका देखो क्या बेटा आवाज नहीं आ रही उनकी
Am I audible now?
उनकी आवाज नहीं आ रही मुझे नहीं आ रही उनकी हाँ
Hello.
आवाज नहीं आ रही मुझे
Mm.
कैसे
Am I audible now? Dr. Harshni, am I audible to you now? Okay.
I'm am I audible?
Yes.
Yes, now I can hear you.
Okay. So we have a few questions. I think. All right. So Manu is asking tips for long sitting. Means like if they have a desk job and they sit for quite long. Like one of the things you mentioned that probably they should stand up and walk a bit after 30 minutes or so. Any other tips that you wish to share?
Yes, there are some form of sitting exercises which they can very much do when they're sitting on the chair. So, just a second, just a
Mhm.
second. I'm just getting an important call. Just a second.
Mhm.
Coming to this, I'm so sorry, I was out for some important call. Okay, coming back to the question. There are certain form of exercises. You can see me here. You can just do a simple side bend. You can do simple rotations. You can do simple neck movements on your chair while discussing your meet. Or you can do simple knee, leg raises, foot movements. You can do up and down, clock, anti-clock. Make this as a habit. But these things again in the duration when you can't stand. Don't compensate this exercise for the need of changing of your position. This is a common mistake what people do. When I advise these exercises, they tend to forget that I have to be out of chair, I have to stand, and also at many times they get so addicted to sitting that for even small things also they want that someone should provide them in their hands. So make a habit of taking water on your own, make a habit of taking a food on your own. Keep that space. Only in the tough times or tough days when you can't move out, then yes, you can keep moving your these movements in between in a very natural way that other person is not going to judge you or see you that you're exercising. I mean, try to use more your words in the form of expressions or nodding your head. So this also makes your exercise happen and you can really enjoy this way. So I can see a question from you, Dr. Nagarajan Ravindran ji, about we get fatigue and a lot of headaches while using laptop. So again, now these headaches are not nothing to do with your brain. Most of the time, these are the postural pains referred into your headache from your neck. So this shows that your neck muscles are getting weak, and weak muscles lead to malalignments at the vertebral or the joint levels, which need to be addressed and fixed through biomechanics correction. And then you can really enjoy the real essence of strengthening your exercises, and it will keep you away from headaches. Because these headaches are mostly, they tend to convert into migraine at some time. So people with migraine or headaches, they say we can't absorb sharp lights, or we can't travel, or we can't stay hungry for long hours, or the acidity again which triggers my pain. So these symptoms most of the time are the referred pain from your cervical or the TMJ, the temporomandibular joint. Your jaw bone or the jaw joint is not able to function properly in alignment. So that becomes the biggest resource of your pain. So again, this can be very well addressed. So you need to meet your expert wherever you stay. Try to find out a pain rehab expert around you or the MSK physio, and pay attention on that. It can be fixed very nicely.
So, Dr. Nagarajan, I hope your question is answered, or you have any more questions on that? In meanwhile, Pratyut had one question. What can be done to avoid knee replacement for parents?
Yes, so these are the really very wonderful question, I should say, because as I mentioned, stop thinking about surgery the moment you come into knee pain. Okay? Stop believing that knee surgery can only treat you, because medically and ethically, the knee surgery was invented to help patients in the need of some other resource of pain. Pain should never be the reason of your knee replacement surgery. Remember this, because even medically, what we learn into our books or what the latest journals are saying, that the reason for your knee replacement should be a really bad arthritis or when the conservative line of management fails. Now, conservative line of management usually restricts towards painkiller, anti-inflammatory, calcium vitamin D support and exercises, or the reduction of the functional movements. But the element of alignment correction or addressing the resource of pain, because 60% knee replacements are not needed. You know, this has been told by a very leading orthopedician from AIMS Hospital, because he says the pain is coming from spine. Even if we do knee replacement, the pain is not going to get cured. So, first thing, the moment you land up with knee pain, stop thinking, I need a surgery. Second thing, for the knee, definitely you should be working with the knee health from the beginning, from school days, college days, not once you are pain into pain. Because once you land up into pain, then you need more for pain rehab expert and alignment corrections. Not just the exercises are going to help you. So alignment corrections can be done only through hands-on therapy, only by expert. It cannot be done by self or any other holistic approach. Even though if you're opting for a holistic approach, no harm. But parallel, you can run this pain rehab services along with your holistic approaches. Your knee will do wonders, and you can always stay from away from knee replacement surgery lifelong. So I have released some of my podcast on this tips to avoid knee replacement surgery, how you can stay away from low back pain. I will share some links with Varundeep, and ma'am, you can share these links on your group so
Sure.
that they can go through this podcast, and a lot of information and a lot of exercises and details have been mentioned there,
Mm.
which when taken care works wonderfully.
Right. Thank you, doctor. Pratyut, I hope your question is answered. If you have any more questions, let us know. And now we asking, is it necessary to take supplements and nano shots of vitamin D3 along with exercise?
Oh, yes, it is very important to take supplements, especially for the females. And post-menopause, it is very important. Now, these days, the studies are coming up. Even post-childbirth, it is very important to have the supplements. The duration of supplements, the amount of supplements should be definitely directed to you by your expert. Don't try to self, like what happens usually. You have visited a doctor and they have told you that this vitamin D you have to take. Now you have taken it, you got benefit. Now you know that this works. So later, what you try to do whenever you get the pain again, then you try to take the same supplements, believing that this will take you out of pain. This is a wrong practice. So once your doctor has prescribed, doesn't mean that every time you can take the same vitamin D amount or the same salt every time you can take, because the toxicity of vitamin D is also very common these days. And also, you should understand what is the score of vitamin D which is really bothering or contributing to your pain. Now, if I talk about the range of 15 to 20 of vitamin D is something good enough for the joint health. If you go to endocrino department, say for some thyroid issue or some other diabetic issue, they will say the vitamin D level should be around between 25 to 30. So the range also varies department to department. But just seeing that blood level low on your blood reports doesn't indicate that yes, you need vitamin D supplement. Yes, but alone vitamin D cannot keep you pain free. You have to exercise. Vitamin D, massages, painkillers are not the substitute to exercise. At times, I'd love to say if exercises were sold in the form of medication, I believe exercises as a medication would be the then largest selling medication on this earth. But sadly, there is no medication formed for exercises, and you have to move and you have to exercise. The right form exercise, are you eligible for exercise? These things need to be taken care of. Next question I can see is that someone is asking for the tailbone pain reverse. Yes, Miss or Mrs. whoever is, yeah, the Mr. and Miss, it can be reversed. Tailbone pain, again, I have a podcast on this. I will share a link to you, ma'am. But the tailbone pain can be easily rectified. Only the alignment issues need to be addressed. There are people who have an experience of tailbone fracture, or they have hurt their tailbone at one particular moment. Either they have fallen, or post childbirth, the tailbone pains are again very common. So, or even with the long sitting hours, the tailbone pain is very common. So, these things can be easily addressed, and you can live a pain-free life without the need of that ring. A lot of people they call me, can I ever be rid of that ring, sacral ring or the sitting ring? Yes, you can be rid of that and you can live a very happy life without tailbone pain. It's very much possible. But again, you need to see the pain rehab expert. You need to see a person who is into this malalignment correction, as I mentioned about this expertise into physiotherapy.
Right. Any other questions anybody has? I will share the links which Dr. Harshni will share. Apart from that, if you have any questions, let me know. Okay, so Gagan is asking, please suggest quick stress relief techniques for office desk.
Okay. So I hope a lot of people are aware of this meditations and spiritualism, and then some motivational talks, then staying calm, deep breathing exercises. These are quite familiar resources of staying stress free. But again, to make these things effective, you have to be physically pain free. So, like how we say, a brain stands on a spine. If your spine, shoulders, back, neck, mid back, hips are pain free, stiffness free, you are exercising, you're moving around, then only these techniques like deep breathing exercises or spiritualism or meditation is really going to help you in a better way. So, always remember physical stress can be easily managed through the right expert and right expertise. And the moment you are out of the physical stress, You will be able to take a lot of mental stress happily in a wise manner, in a decision taking manner, in a very productive manner, in a positive manner. But if you are facing a lot of physical stress, a physical pain and stiffness, then these stress relief techniques are not going to be really helpful to you to a greater extent. So remember to apply the stress relief techniques. Yes, you have to be physically stress free. Another important thing is that exercises. It is a very important tool to reduce your stress because exercises induces dopamine, melatonin, the happy hormones in the body, and they immediately act as an antidote to your stress. So whatever harm your stress is going to cause in the body, even your stress taking capacity and also to take you out of the stress, these hormones work naturally in your body, which can be easily, the amount of these hormones can be easily improved with the help of exercises. But the right form of exercises and also understanding that yes, you're eligible for these exercises can really keep you into a stress relief zone.
Right. Any other questions? Okay, maybe you can share your feedback about the session in the chat. It will be nice to know how you felt about the session and how insightful and useful you felt this session was. So, Dr. Harshneet, I think there are no more questions. Largely, you have covered a lot of things, and especially the myths and the fallacies we tend to carry in our head. And today's session was quite insightful. And like you mentioned, surgery is not the ultimate cure that we are, or the first cure that we should look at. There are a lot of other things and realignment that are possible. And I am highly grateful to you for this insightful session. I will share your details you have already shared and the videos that you will share with me, with everybody. And I think Vijay has one question. What exercises should you do regularly to keep yourself in future or in good health? Maybe you can suggest, or if you have any videos, maybe you can suggest.
Definitely, I have made a podcast on this also for the safe exercises. Safe means which I can do without the supervision of my health expert, maybe a physio or a yoga expert or gym. And the unsafe exercises is a list of exercises which one should always think for a plan only under the supervision of the health expert, not just randomly believing that exercises का side effect नहीं होता. There are very much possibilities of getting side effects of doing exercises also. Exercises also can cause harm. So there's a list of exercises. I will share a video on this because demonstrating exercises right now will take another an hour, and there were maybe a lot of people who would like to try along with me, and maybe they are not really prepared for the same. So sharing link will help them to discuss on and to see what are safe and unsafe exercises.
Maybe we'll arrange another session for that, where we will let the people know that how they should be prepared for that. And I
Yes, we
think
can
that
have
will
a
be
next
helpful.
topic on this. Yes,
Yeah,
definitely we can go for the next topic.
right, right. Okay, so I think that's all. Really insightful session and very useful and practical session that we had today. It was not just a mere talk where some speaker has or expert has come and just talked about. I think there are a lot of things that have we have absorbed, and I think many of the things can be practiced and situation can be turned better. And like you mentioned, don't cure everything at your own will. Go to an expert and find out. I think that is what another key takeaway that I'm taking from this session. So once again, Dr. Harshni, thank you for finding time from your hugely busy schedule that I know. And thank you very much. I look forward to have you sometime soon on our session again.
Welcome, ma'am.
Right. Thank you so much. Thank you everyone for joining. Thank you. Bye.